Hello everyone. Can you guys hear me?
Hello, sir. Yes, we can hear you.
You guys can turn on your video and audio if you want, and you can ask me if you have any specific questions. Okay. So many are here. So you guys just clear your written exam?
Yes, sir.
Good. And have you registered for the OCE or no?
Not yet.
Not yet. Okay. Okay, Sivangi. Anyone here who are not in Ontario and planning to give OCE?
Hello, sir. I'm Anandi here.
Hi, Anandi.
Sir, I'm from Alberta, but I'm thinking of giving OC exam, but I'm completely unaware about it.
Okay, that's okay. We will help you out, right?
Okay.
And the payment issue in Ontario, that's good. They're supposed to give you then free exam now, right? That was not issue from your side though, right? We tried to give you money, but you didn't take it. Send them an email. Okay. So before we start, just let me introduce myself. Myself, Mehul, and I've been instructor um, since I think 5, 6 years we've been teaching. We started this course when we were, when the CAPR were taking exam for the in-person exam, and there was one standardized exam. And then COVID happened and CAPR couldn't take the exam, and now provinces are taking their own exam. And we've been teaching OCE since it started, and so far we have really good results, and we would like to help as many students as we can. As written, students are very satisfied with StudyBuddy, and we want to continue that they can become registered PT. So we will try our best, and we are trying our best to help all the students. Before we start, anyone has any specific questions so I can help them out? You can ask me or you can put in a chat box and I will take a look over there, okay? Okay. So today I will explain very quickly about what is OCE, and then I will discuss about what we are offering. And we usually take one orientation class, the first class, and we will be taking also. And we will go in more detail about the OCE. But today, just to give you some basic brief idea about what is OCE, and especially for those who are not in Ontario and they are planning to appear for OCE from Alberta, British Columbia, because we do have many students who are appearing for OCE from Alberta and British Columbia, and so far they have really good result and they are working there as a registered PT now. So if you have any question that if you can give OCE from Alberta or British Columbia, yes, you can. Okay.
So
So
after giving OC, can we work in Alberta or BC?
yes, you have to register in Alberta or British Columbia, any province that you want to work. Once you clear your register clinical exam in Ontario, you become a full licensed registered physiotherapist in Ontario. Then that license you can transfer to any other province you wish to work. But you do have to register for the Ontario exam and provisional license, I think. And there are whole process given how to register for the OCE exam, and that you can do it. So, and as you have, if you have any specific question for your particular case, you can always reach out to us and then we can help you out more.
Thank you, sir.
Do we have to appear for any other exam again if you move? No, you don't. Once you are registered PT, you are registered PT in whole Canada, right? So let's say I'm right now in Ontario, registered PT. And if I want to work in Alberta, I can just move and I have to register with the Alberta College and then I can work as a registered PT there. So no any other exam unless you want to, increase your skills and do any course. No problem. Okay, so let me start with some basic idea about what is OCE. I'm not going in very much detail, just to give you basic idea because we are already taking orientation class where we go in much detail about what is part one, what is part two. Okay, and just to give you some basic idea, and if you have any question, you can always ask me or put in a chat box, and then I will address those questions. So basically, exam structure is in Ontario. We have that's called the OCE, Ontario Clinical Exam. There's two part of the exam. Part one and part two. Part one is based on the uh, uh, MSK cardio neuro multi-system base. And the part two is ethical case scenarios. In a part one, there would be two big case studies. One would be assessment and one is treatment. And part two, in ethics, there are 11 short case scenarios. And each cases, they can ask you that they can probe you a lot. Like depends on sometimes your answer. If they require more answer, they can always probe you and try to get the more information from you. And they are also asking some core question, and based on your answer, they are making all these norms, and they will provide the marking system. And at the end, you have to make certain domains that is given on the college website. If you made all these domains, then you can pass this exam. So in a part one, as I said, it's a two big case studies, right? One is assessment and one is treatment. So so in a case one is usually is a case one is a assessment case where they are going to check your your skill of assessment, how would you take the consent, clinical, your examinations, how would you diagnose the patient, what are the recommendations you can provide, etc. And the case two is a treatment based case where they will provide you all the information and how would you make the treatment plans, goals. If the patient needs any referrals, how would you monitor any discharge plan, etc. And each and every question has their own probing questions, and that's how they take the exam. And ideally, you should finish in 1.5 hours. Part one and part two, they ideally tell you to finish in 1.5 hours. But 3 hours exam is your time. You can take as much time as needed in any questions, as long as you are keeping an eye on your time and you can finish your exam before 3 hours. This is the sample case study we will explain quickly in our orientation class about what kind of case can be asked, what kind of questions, what are the findings they can provide, and how would you answer those were the questions answered. Part two, as I said, ethics is 11 short case studies. You have to finish in 1.5 hours, 90 minutes. There are one core question usually given. You should take around 2 to 3 minutes to prepare your answer. You can finish if you are prepared earlier, you can just start answering. And depends on your answer. Sometimes they will probe you 1 or 2 or more probing questions based on your answer again. There are so many videos they have already posted on college website about how the exam is taken, and they usually put the live webinar where you can attend that webinar and ask the questions. They usually put before the exam, so you can always check the updates from the college website and participate on those webinars. Is it like an interview? No, Sumit, it's not like an interview. Interview is something that just ask the questions and you have to provide the answer. This is something that needs some strategies to do the proper preparations. When you have the case study in front of you, by the case study, what kind of information you will note down, how would you form up your answer, what things you should include in your each and every question's answer is a kind of strategies that you have to follow, and you have to provide the answer that your examiner needs and whatever's appropriate answer. Okay. No, they don't have the fake stations or fake patient. They will just present a case study. As I mentioned earlier, I just saw the sample case study, and you will have some time to prepare for the answer, note down your important information, and then they will ask you main core questions. For example, how would you do the subjective assessment of this patient? And based on the case study information, you can explain that, okay, I will ask those kind of questions, pain related, stiffness, or I will ask where is the pain, and based on the patient answer, then I will finish my subjective assessment. I will ask social history, past medical history, any red flags you need to rule out, etc. And then you can move to the objective assessment, what you will do, how you will do, why you will do. Okay. So those are all these different questions. And I'll explain you how we can help you out in our course. And okay. So these are the 11 standards, and each standards they are taking, you will have each case studies based on the PTA, ethical issue, prioritization, professional boundaries, confidentiality, privacy, infection. So all these 11 standards, they will have one case study, small case study, and you have to answer whatever the questions your examiner asks or whatever the questions in the case study they have already presented. This all information that I am presenting, that's already on a college website. So you can go collegept.org and check out about all those informations from there. Some standards that you have to keep in your mind. We will go in details about it. Okay. So let me explain about what we are offering in our course. So as I mentioned, it's a case study. So we will have 17, 18 case study based lectures. Me, Radhika, Vrinda, and Ankit. Ankit is teaching ethics part, and me, Radhika, and Vrinda, we are taking lectures on part 1, MSA, cardio, neuro, multi-systems. And we will also help students if they have any question regarding ethical part as well, as we are also offering mentorship and mock exams. Now, in each case studies, we are discussing live and we record the lectures. So in case if you missed out, you can watch the lectures, or you can rewatch the lectures and practice from that. And once you join the course, you will also get the recordings of the previous batches also. So you can start preparing from day one. Anyway, the lectures are around 2 to 3 hours long, and we present case study. We discuss what kind of core questions can be asked, how you should answer, what you should include in your answer, how you should modify your answer based on the case study information, what to include in your answer, what kind of probing question can be asked, and how you should answer. So those all things we are explaining, we are teaching. So out of 17, 18 lectures, you will get to learn more than 50 case studies. And we also provide samples, case studies with the answer keys, notes. And once you join the course, you will get that too. And you can make the preparations from there. Apart from that, we will also add you in our WhatsApp group where we have so many students going in October and January exam, or probably later on. And you can find your study partner, which is essential for this exam to have a study partner. So you can practice with your study partner and improve yourself. Um, because at the end, you have to speak the knowledge you are having, you have to, present your knowledge and explain whatever you know. And that requires the different kind of skills, and we mentors will help you out to, sharpen your skills and all. So apart from these live lectures, once are done, we are also providing mock exams and mentorship. The mock exam and mentors is currently running on for the October batch. They are going for the next month exam. So we mentors are busy to provide the mentorship and the mock exams. So I will explain you about the mock exam and mentorship in details. So mock exams. So we have three different mock exams, and we have just like a 3 hours long mock exams. In 3 hours, once you start your mock exam, and once you finish your mock exam, we will be just giving you experience as a how you should feel in your real exam. Because once you're preparing, you can answer, but 3 hours sitting and 3 hours speaking and focusing on each case study, you will require that kind of practice so you can easily perform your real exam. And we record the whole exam. And once the exam's done, examiner will provide you detailed feedback about how you perform, what you have missed, how you should improve. This is like a 30, 40 minutes feedback once your 3 hours exam's done. And then the whole exam recordings we are providing you. So you can watch your performance and you can try to improve yourself. I usually provide advice to all the students that keep at least watch 2 to 3 times at least feedback part. So whatever the mistakes or advice given from the examiner, you can try to improve more. So that's way it will definitely help you out a lot. Mock
So
exam,
it will be one-on-one session, like one-on-one exam.
yes,
Like,
one exam, yes. Nobody would be there, yes.
okay,
Okay,
thank you.
no problem. So just like your real exam, let's say I took the exam yesterday, one of the students. So I present the part one, first case study, then I ask, I probe, and then I present second case study, then 11 ethical case scenario, and then once the whole exam's done, then I give feedback. So like that. Now, about the mentorship, as I said, me, Radhika, and Brunda, we three are providing mentorship class. And mentorship and mock exam, we are only providing to the enrolled students. So you have to enroll for the course. Um, the reason is that initially just one batch, I think we were providing mock exam and mentorship to everyone, but it was too difficult for us to focus on each and every students. And we want to give more priority to the students who enroll for the course. And plus, once they join the course, they have already idea about how to prepare, and all this information that we are providing in the live lectures, they are already know how to practice. And when they come to us, we just have to find it out how we can help them more in detail, because this exam require the personal attention. If someone is making any kind of mistakes, I need to make sure that I will help that particular person. In a live lectures, we are just providing general feedback, but when we have a mentorship class in a small group, I need to improve where you are lacking. Do you have any problem in assessment, or you have problem in making goals or making the discharge summary? That's my job to find it out and help you out to improve in that. And that will start probably 1.5, 2 months before your exam. Um, and we will have six sessions weekly based, and that will give you more detailed personal attention and to boost up your confidence and improve your skills where you are actually lacking. So that's where mentorship will help you out a lot. Any
Sir,
question? Yes.
I have a question. So it's like you first take live lectures. Do you know how long it takes to complete the lectures, like the
Uh,
course?
with the course, you know what, I can actually present our next batch schedule. Our next batch schedule is starting from mid-October and it will be done within a 5 to 6 weeks maximum. And we will have roughly 3 to 4 lectures per week. So 17, 18 lecture will be done by 5 to 6 weeks. And let's say this course, these classes are for the January students. So mid-October to November end, the whole course will be done. So December and January, we will be focusing on the mentorship and the mock exams. So January end, they are prepared for the exam. So that's how we schedule our all the classes, mentorship and the mock exams. And we have so
s-
many students are going in October actually, and we have like probably more than 150 mock exams this time for the students who are going for the October. Sorry, you were saying something?
yes, sir. So we take classes for 6 weeks, and then we join the mentorship again for 6 weeks.
Yes,
Okay.
and mock exam during that period of time.
During the mentorship program time.
Yes, because the mentorship will start probably 1.5, 2 months before your exam. So
Mm-hmm.
the mentor will be with you until the end of your preparation. And you know what? Once you enroll, mentorship and mock exams are optionals. Um, However, it will give you more better chances of passing this exam because you will get more personalized attention. But it's optional, and we always encourage our all the students to reach out to us if they stuck anywhere. So it's not just if you take the mentorship, then only you can reach out to the mentors. You can reach out any mentors anytime, whatever the doubts you have, and we will help you. And we also encourage students to put the question in a group where we have like almost 150 students and everyone can participate and answer over there. So that kind of group discussion also going on our WhatsApp group.
Sir, I have one more question. So, for example, if you are my mentor, then you will be taking that mock exam as well.
Mock exam, we like I take some mock exams depends on my availability, and the same goes with the other mentors as well. And we have hired examiners who are also professionals and been doing great job since almost a year now. So they are also very good in their feedback part, and it's all about how to give 3 hours exam and how to deal with your anxiety during the mock exam. So when you give your real exam, you will be more prepared and comfortable. Uh,
Thank
then
you, sir.
no problem. At the end, this is the real exam, right? Real exam pressure is always high, and no matter how good your preparation is, at the end you have to deliver, right? Sumit, enrollment is for a year of OCE. Yes, we are providing 1 year of access. However, so far we rarely get any students who needs more than 1 year access. Ideally, we don't any charge if you need more than 1 year. In case if you missed out any exam or you just postpone your exam. So far, as I said, we have really good passing rate. More than 95% students are passing. So they don't really need 1 year of access. If I
Uh,
go
ha-
OCE, what's the best time to start batch? You can join now and you can take the advantage of, watch all the previous recordings. And the next month when we start the live lectures, you can join that live lectures and participate if you are prepared. And anyway, you will have 1 year of access, right? Sorry, you were saying? Uh,
uh, Sir, I have one more question.
yeah.
So, uh, basically, it will take at least 3 months to get prepared. So, I'm just scared about going like applying for the OC. I'm thinking maybe I will not be prepared for January, but I can still take the mentorship and mock exam even if I'm not going for January.
Ah, look, ideally, if you're not going in January, usually, mock exam and mentorship that you have to pay. And once you pay, and if you want to take the January mentorship, you can, contact the mentor and you can take the mentorship and you can attend all the lectures. But if you are going in March, then you won't get again mentorship classes with a mentor, right? For example, once you're done with your live lectures and side by side you are preparing with your study partner. So when you come to me in the mentorship class, just giving the example with me, Radhika, Unda, anyone, and so we try to find it out where you are lacking. Now, if you're going in March and when you come and join the January mentorship class, which will start probably in November, you won't be as serious as you are going in, right? And I'm sorry.
Okay, I found this on the web for.
Siri activate a lot. Anyway, so you won't be that serious about your preparations, and we cannot actually help you out more than where you are lacking. Because when you are close to your exam, we want to improve you. You are lacking here, you are lacking here, you are lacking here, right? And so much correction needed. And once the mentorship classes are done from January and your exam in March, so you will have 2 more months. In 2 more months, you may improve a lot, or maybe you will, you don't prepare well and you are making more mistakes and nobody is there to correct you in more details. We will help you out if you ask us the question, but we cannot see your performance in detail and help you out to correct your mistakes and improve your skills, right? So that's why it's always advisable to take the mentorship just before your exam. So we have all these slots that, right now the October students mentorship classes are going on. Then January mentorships classes and the mock exam will start once the live classes are done from November. And the same thing goes with the March and the next year, all the exams.
Sir, so if you feel like during the mock exam, if you feel like we are not prepared for the exam and you just ask us to not to go for the exam, and then we can again do the mock exam or again take the mentorship course?
Yes, you can. It's actually happened one time that the student was not prepared and that not prepared. There was some emergency and she couldn't give the exam. So first couple of classes she attended and then she has to move her exam to the next slot. So yeah, you can continue, but each and every time whenever you give mock exam, you have to pay. Mentorship classes are depends on the mentor and how many lectures you have already completed. Let's say you already completed 4 lectures out of 6. Then it would be very difficult for the mentor because you already learned whatever you need to learn in that mentorship class. If it's a genuine reason or something, we can always accommodate in the next batch. So it should be okay. As study buddy, we are together till you pass your exam, right?
Yes, sir.
Let me see the question. So when would you suggest to upload mentors if we are taking exam in March? You can approach us now and enroll. Look, it's a 1 year of access anyways, and earlier is better because you can start to learn because there are so many lectures and each and every time whenever we take class, we try to modify. We try to do some modification in our lectures. So whatever the lectures you will learn from the previous batch, you probably get something new idea because each and every time we have different kind of discussion, different kind of questions students ask, and based on their answer, we try to give the best possible feedback and advice. So each and every time you can learn more. So you join now, there's a lot lectures that you have to go through 2 to 3 hours. Then you can start watching weekly, and then once the October batch start, you can attend live, ask any questions, and if you cannot, you can still watch the recordings. Okay. For mentorship, you have one-time access, and that would be before your exam. Any other question, anyone? How much time did you say that you to think over a case study? Like once they present a case study, that how much during the exam, I mean, depends on the case study. Part one, first big case study, they usually say that you should take 4 to 5 minutes to prepare your answer. I usually recommend it that the first questions answer, you want to give your best possible answer. So if you need more extra time, you can always ask more time and then prepare and then give your. And it depends on how you practice. You probably need more time. Okay, so this is the fee structure. Okay. Just go through it. Okay. So our course fee is $9.99. In the course fee, we are providing all these lectures, sample case studies with the answer keys. We have you in our WhatsApp group. You will get the recordings of the current batch, previous batch, and we have started the group discount. And in a group discount, if you 3 or more students join together, we are providing $100 discount to each. If you are 6 or more students group, you will get $150, and 10 or more, you will get $200 each discount on a course fee, which is $9.99. Mock exams, we are only charging $2.99 for one mock exam, and we have combo of 3 mock exam for $7.99. All 3 exams you can take with the 3 different mock examiners, and you will get the multiple different kind of feedbacks from the examiners. And mentorship fees is $3.99 for that will start after the live lectures done before your exam. And as I mentioned earlier, you can choose your mentor. Me, Radhika, and Munda, we 3 are providing mentorship, and you can choose any one of us and you can take their mentorship. So you can contact them directly.
Sir, is there any time limit, like we have to contact the mentors?
As long as they are available to take the students. So it depends.
Okay. So we can choose to do mentorship whenever we are prepared for that.
Yeah, you can choose any one of us to be your mentor, and whoever you feel more comfortable. We 3 are providing mentorship. How many students do you mentor take maximum per exam? That's a tricky question. Like, I'm not sure about Radhika and Vrunda, but I was not planning to take many students, but this in October I have 32 students who are going for the October exam. In January, still open to take the students. The same thing goes with the Radhika and Vrunda. They are also open to take the more students for the January too. How much time is given for the each core questions? As long as you need more time, you can always ask examiner to ask for more time, and they can provide more time. And then whenever you feel comfortable, you can provide the answer. But remember, you have only 3 hours and they have some probing questions. So make sure you will finish your exam on time. And ideally, we are also taking last minute tips classes before the exam, where we answer your questions. If you have any question, and we just try to help with the time management skills as well. The first questions ideally should be finished in 45 minutes. So after completing first question, you will know that how much time you need, and based on that, you can give your answer a little bit quickly. If you spend too much time, like around 15 minutes, still okay. But if you spend 1 hour for one part, first question of the part 1, then you know that you need more. You have only 2 hours to finish the whole ethics part 2 and one big case study of part 1. How long it will take to transfer license after passing OC for Alberta? Anandi, I'm not 100% sure. There's many students who appear for the OC from Alberta. Contact me. I will provide some contact, and they can help you out more. Is there any fees to register with the college PT after passing the written or clinical exam? I think you have to register for the OCE exam and how to register and what is the registration fee of the exam. That's everything is given on the college website. Orientation class is free. So I usually we keep orientation class free for everyone, which is going to be on October 14. But we haven't decided yet. But most probably we will keep it. However, in orientation class, we usually discuss about what is part one, what is part two, which we go in much detail, and we discuss about our course, what we are offering and how we help you out, and which is what I'm doing right now. So at this time, the orientation class won't be very long, as we have already explained. And probably this thing is recording, so we'll try to keep it on our Facebook page or Insta page, so everyone can access it. Any question, anyone so far?
Sir, I have a question, sorry.
Yes.
So, for example, I'm going for the March exam.
Mhm.
That means I should be able to join mentorship from January, and I should be able to finish all the course by December, like the live lectures and everything.
Everything, yes.
So January and February will be 2 months. I will be taking mentorship and mock exam, and then March I have exam, like that, right?
We mentor will make sure that you are prepared and you are prepared for the real exam. So don't worry about it. As I said, this exam required more personal attention, that how you are performing rather than in a general, because even though you need more more concept kind of thing in a written exam, where you need to learn about what is all this about. But in a clinical exam, it's all about how's your patient handling skills. Um, it's not about anything regarding that, okay, I will, based on the clinical perspective, I'm not asking the question regarding, okay, how would you provide the shoulder mobilization? Can you explain? Can you explain your hand position? What would you make sure? It's not about like that, because if it's like that, they can ask anything, anyone, and it could be the interview-based exam. But they are providing case study, where in the case study, you will get a lot of information about patient's current complaint, past history, other comorbidities if they have, along with any social factor. So keeping all things in your mind, how as a physiotherapist you can help your patients, keeping all the information. Should you refer to any particular other healthcare profession or not? When would you discharge? If the patient has a limited insurance coverage, how would you approach? So many factors are depends. So how to find it out, all detailed information from the case study and use in your answer is strategies that you have to follow, and that will help you out. So that's why you have to follow all the case study information, and you have to provide the answer. Otherwise, I can ask anyone anything regarding, okay, what would you do in a privacy breach, in an ethical case scenario? When would you, what are the case that you will do the mandatory reporting? So it's not like that. They already checked your knowledge, and you all passed your written exam, so you have the knowledge. But now in a clinical exam, it's more like how would you take care of your patients if the patients come with a multiple injuries, with the comorbidities. Can you handle patients, all the information, and keep the patient center standardized care with that particular patient, because if the patient come with a shoulder issue, same injury with three different people, all three requires different kind of exercise, right? Depends on their age, other comorbidities. So as a physiotherapist, how we can determine all this information and help our students in that particular areas. That is what is required for this exam. And that won't be possible by reading or just, learning or just mug up some answers. That's what people are doing nowadays. They just mug up some answer, but it won't help you out for sure. After October, when will be the next batch start? We haven't done the next batch schedule yet, but we will be doing soon. However, even you are going in January or March or later on, we can still join the course, and you can take the advantage of join multiple live lectures, multiple live batches. When is class going to be starting from January? January, as I mentioned, mid-October. From next month, October 14 would be our first class. And then it will be done before November end. And November end. And from the December mock exams and the mentorship will start. Any other
Sir,
question?
my main question was like before, like we should be completing everything before 2 months before the exam, like all the lectures, and then 2 months we'll take for mentorship and mocks. Is that right?
Yes.
And then we give the exam. Okay.
Yes.
Thank you
No.
so much.
So this is our contact number. If you want to take a screenshot, you can take a screenshot. You can reach out any one of us. You can text us or you can email us here, and we will reply. The course fee is $9.99, as I mentioned, and you can e-transfer on our email address, PCE Studybuddy Clinical @gmail.com. And once you enroll for the course, we will be enrolling you in our course, and we will provide all detailed informations and all these notes and everything. Any question anywhere, you can also get all the information from our Facebook and Insta page, where we have multiple posts where you can find our numbers as well, in case you cannot take the screenshot. So I think that's it. Thank you for joining, and I hope you are enjoying your success as a recently passed written exam. And you can reach out any one of us if you have any question, and we will try to help you out. Okay?
Thank you so much.
No problem. Okay, have a good night, everyone. Take care.